There is no study to prove that unvaccinated children have ever been proven to start an epidemic. I have been seeing families in my practice for over 20 years that have opted out of vaccination. They are the healthiest children I have ever seen. And more parents are understanding the dangers of vaccines, and that's why we're seeing such pressure to mandate vaccines, because more of the science is coming out. We assume that if we vaccinate, we're getting protection. We assume that if we vaccinate, we're stopping spread of disease. Those are assumptions that have never been solidified in science.
I asked the dad what happened, and the dad tells me, yeah, the shot went in. He was sitting in the chair. I basically instantly see his whole face goes white. His head like lolls back. You know, he's like staring straight up. His eyes go to the back of his head. He goes limp, and his whole body convulses like 3 or 4 times, maybe 30 seconds or so, maybe after you've been given the shot, roughly. And what's kind of interesting is this is a family who had not vaccinated. They were not planning to vaccinate, and then they decided they had to because of the new school law.
A seemingly completely healthy little girl playing freeze tag in the front yard. Mom wakes her up the next morning. She is paralyzed from the neck down. This after just getting the flu shot vaccine. With me, her mother, Carla Grivna. Carla, why do you believe this is because of the flu shot?
Because there was nothing else, no other life-changing events or no other medications out of the ordinary given. It had been the only thing that had been given to her or happened to her during the time period. And extensive testing was done at the hospital to try to find another cause, and none was able to be found.
Well, I mean, I have to come from the perspective of a parent who has a vaccine-injured child. I took my bright, healthy, precocious little 2.5-year-old boy in for a 4th DPT shot, and within hours of that shot, I witnessed him suffer a convulsion, a collapse shock, a state of unconsciousness, and he was eventually diagnosed with minimal brain damage, including multiple learning disabilities and attention deficit disorder. We have seen children become disabled and chronically ill. 1 in 6 child in America is now learning disabled. Why are so many highly vaccinated children so sick?
A 5-pound preemie gets the same vaccination as a 10-pound full-termer. They need to be individualized.
And explain why you feel this way and why you decided not to vaccinate your youngest children.
So I have 3 children. My oldest, I was kind of the sacrificial lamb. He was vaccinated and had a huge amount of thimerosal, a huge amount of mercury. And after he had the MMR and the chickenpox vaccination on the same day, we never saw him again for 3 years.
Never saw him again, meaning
he developed autism. He lost language. He lost social skills. He lost bowel control. He became very sick within hours of vaccination. So I held his hand over the proverbial fire. He got burned. Don't ask me to line up my other 2 children to get burned again. What kind of parent would I be?
Like if I was a doctor, I would want you to get sick.
Yeah.
Because the more times you get sick, the more money I make.
That's right.
I don't get sick. I'm just being honest. I don't get sick.
Okay.
My children have never been sick.
Okay. They've never been vaccinated.
They've never been vaccinated, none of that, and they don't get sick.
Okay.
Because the mother's milk in the breast is all the vaccination that they need. That's it.
Do any vaccines contain egg protein?
Oh, yes, influenza.
Do any vaccines contain gelatin from pigs?
Yes.
Do any vaccines in the childhood vaccine schedule contain human albumin?
Oh, yes.
And what is human albumin?
Human albumin is part of human serum. Part of the blood that is liquid.
That could be problematic, right?
Well, it could be. I mean, if the individual is not healthy,
or if maybe some of the human blood components bind to some of the aluminum and develop antibodies, self-antibodies, correct?
If they develop antibodies against a serum component, that would not be good.
Do any vaccines in the childhood vaccine schedule contain MRC5 human diploid cells?
Yes. Rubella, varicella, hepatitis A.
What are MRC5 cells?
They are human fibroblast cell strain They were created by taking fetal tissue and from a particular fetus that was aborted by maternal choice, and the cells, the so-called fibroblast cells, were cultivated.
Do any vaccines on the childhood vaccine schedule contain WI-38 human diploid lung fibroblasts?
Well, they used to, but I don't think anything is made in those cells anymore.
If you could turn to page 3 for MMR and MMRV. Do you see that within the ingredient list that lists WI-38 human diploid lung fibroblasts?
Yes, I do see that.
Isn't it true that human DNA in vaccines is typically purposely fragmented?
Yes, I would say mostly for theoretical reasons, doesn't want to put DNA into intact DNA into vaccines.
These fetuses were all 3 months or older when aborted, correct?
Yes.
What organs did you harvest from these fetuses?
Well, I didn't personally harvest any, but a whole range of tissues were harvested by co-workers.
Okay. And these pieces were then cut up into little pieces, right?
Yes.
And they were cultured?
Yes.
Okay. Some of the pieces of the fetuses were pituitary gland that were chopped up into pieces. Okay. Included the lung of the fetuses?
Yes.
Okay. Included the skin?
Yes.
Kidney?
Yes.
Spleen?
Yes.
Heart?
Yes.
And tongue?
I don't recall, but probably yes.
Are you aware that one of the objections to vaccination by the plaintiff in this case is the inclusion of aborted fetal tissue in the development of vaccines and the fact that it's actually part of the ingredients of vaccines?
Yeah, I'm aware of those objections.
Okay. Are you an atheist?
Yes.
When you were a child, what vaccines did you receive?
Diphtheria. In childhood, I think it was probably only diphtheria. Only diphtheria.
You're going to let the government run healthcare? They screw everything up. So why would you let them be the ones to stick a disease into your arm? I would never get a swine flu vaccine or any. I don't trust the government, especially with my health.
This is thimerosal, which is labeled very toxic. It has cumulative effects, can cause damage to the kidneys, to the respiratory system, skin, to the nervous system. It specifically warns on here that it can cause reproductive and developmental toxicity, meaning that it can cause things like autism and other neurodevelopmental disorders. This is immensely toxic stuff. And this is what's in the vaccine. It's important to realize we're talking about a whole range of products. Vaccines are a big one because, of course, you're directly injecting it. For example, this is tetanus vaccine. This one expires, it's a little outdated now, in 2007. Here's the thimerosal. 1 to 10,000 is a preservative. Perhaps the biggest one in the U.S., at least, that's for exposure to mercury is the influenza vaccine. Influenza vaccine is now recommended for all pregnant women, all infants, all children on a yearly basis.
It needs to be stopped.
This is the influenza vaccine from Adventist Pasteur, their flu zone. Thimerosal, 25 micrograms of mercury per dose.
But I'd like to point out that a lot of people didn't know, and I'm one of them. I've given 2,000 RhoGAM shots. I've been in vaccines for 35 years. I didn't know that RhoGAM had thimerosal in it. So I think a lot of the doctors were unaware. They were unaware that even the word thimerosal meant mercury. Mercury.
The science is settled. Vaccinations work. They save lives. Here's how vaccines work. We study a germ, that is, a bacterium or a virus. We call this particular one Gary. So to make a vaccine, scientists take the bug and modify it so that it can't hurt you. Then by placing it in your bloodstream, like this, your white blood cells learn to recognize that germ, and when they do, they attack it. So should we have laws that require vaccinations? I'm not kidding about this, people. It's serious.
First of all, aluminum. What happens if you inject it when you're a baby? Has there ever been a safety test on it? Never. Not in the history of man have we ever said, what does it happens when we inject aluminum? We don't care, Bill. Gary gets a little shot of aluminum in there. So we're going to take mercury. We're putting it inside of Gary here. Most toxic substance, by the way, that's not radioactive. Check out your flu shot. You pregnant women are going into your doctors. They've decided it's a great idea to have mercury being injected into Gary, which is going into your fetus. How about formaldehyde? Have you seen any of the articles on formaldehyde? The science is settled. It's perfectly decided. There we go. Formaldehyde for everybody. Wonderful. What's next? That's right. Antifreeze, propylene glycol in your vaccine. But don't worry, because we know that Bill told us it's safe. So here we go into Gary. Now we have what is really a vaccine. See this oozing, disgusting mess? There we go. Here we go. Stuff that. Get it. Oh, you can eat it. There we go. Oh, he's got it. Oh, yeah. Bill Nye and no scientist in America wants to talk about. Where does that mercury go? Where does that aluminum go? They're not finding it in your urine. It's not disappearing when you take a crap. What it's doing is it's being found where? It's going into the brain. And when it hits the brain, that's right, encephalopathy, brain swelling. It's written inside the labels. That's a known side effect of every vaccine we get. And yet Bill Nye wants to leave that part of this story out. Deadly, poisonous, toxic chemicals and metals. So when they try to tell you the science is settled, that vaccines are safe and effective, you have to know that we've paid out over $3.5 billion with a B in damages to children who have been killed and injured by vaccines.
We're going to go take a look at a rash after a shot that was given a couple days ago. Let's go take a look. We had the Tdap, which is tetanus, diphtheria, and pertussis. We use an acellular pertussis vaccine here that does have aluminum. It's impossible to get one that doesn't have aluminum in it. I drew lines around this. You know, parents, when you see a large reaction like this after a vaccine, it looks like an infection, but it isn't. It's that aluminum, probably the aluminum. There are other ingredients that might be irritating. Overnight, in a 2 days after the vaccine, and I would not do this same vaccine again, because once you've had a large local reaction like this, you would be at greater risk for a really bad reaction.
Leo Smith was a year and a half old when he had a bad reaction to a vaccine, and tonight his mother is sharing his story for the first time.
This video of Leo Smith was shot about 8 months after he received 2 vaccine injections, including one for diphtheria and whooping cough, hours after getting the vaccine.
Within about 3 days after that he started to have hives and whelps and joint swelling.
Amy Mitten-Smith says within days he had hives, joint swelling, and a fever, and within weeks, seizures. 2 months after the injections, the symptoms subsided, but Leo stopped talking. 8 months later, the original symptoms returned after Leo caught a cold. This time, Leo developed an eye tic soon after he was diagnosed with autism and later other neurological disorders.
I thought I was protecting him by taking him in to get his vaccines, and I ended up injuring him for the rest of his life.
The vaccine court ruled that the vaccine did in fact injure Leo and awarded him $55,000.
I regret not looking into it, and now it's too late. Too late.
I'm glad I'm retired now, because now I can talk to you. Because you know what? While I worked, I couldn't. Because if I did, conflict of interest, I would have lost my job. That's truth. A lot of my colleagues did lose their jobs. How did I survive 20 years and never get the flu in that environment? ER. High volume. Was I not on the front lines? Every flu case, 300 people a day. Every flu case, it was me. I never had the flu. You know why? I knew how to wash my hands. I knew how to take vitamin D. I knew how to take elderberry syrup.